Hi, I'm Tatyana Kushner. I'm a hepatologist at Mount Sinai. And I will be addressing the important aspects regarding the screening and management of hepatitis C in the context of pregnancy. So, the first important aspect regarding hepatitis C in pregnancy is that it is now recommended that all individuals be screened for hepatitis C during pregnancy. This is the recommendation by all major societies in the US, including the AASLD, the IDSA, ACOG, which is the Obstetric Society, as well as the CDC and USPSTF. And ideally, individuals should be screened with a hepatitis C antibody with reflex to PCR at the initiation of prenatal care. Now, when someone screens positive for hepatitis C or is known to have hepatitis C prior to their pregnancy, it is important to discuss risk factors. And knowing that injection drug use and substance use are really critical and important risk factors for hepatitis C in young people currently, it is important to assess for substance use and link to care during pregnancy in a stigma-free way to make sure that substance use is addressed in conjunction with hepatitis C when relevant. Now, when someone has hepatitis C in pregnancy, counseling should be provided regarding the association of hepatitis C in pregnancy with potential adverse pregnancy outcomes, as well as the risk of vertical transmission or mother-to-child transmission. So when someone has hepatitis C, it is important to share with them that evolving data has suggested that having hepatitis C during pregnancy can increase adverse pregnancy outcomes, including intrahepatic cholestasis of pregnancy, preterm delivery, and potentially bleeding in the context of pregnancy and delivery. In addition, there is a risk of vertical transmission. That risk is around 6%, but increases in those individuals who are co-infected with HIV. And currently, unfortunately, there are no specific methods to lower the risk of vertical transmission, such as what we have for hepatitis B, where we have a hepatitis B vaccine that can be provided to the infant after birth. We don't have that for hepatitis C. And finally, a really critical part of addressing hepatitis C during pregnancy is planning treatment. So current standard of care is recommendation for treatment of hepatitis C after pregnancy and breastfeeding is complete. That being said, there really is emerging data about the safety and efficacy of DAAs, direct-acting antivirals, in the context of pregnancy. So there's one published study using Harvoni in the context of pregnancy that was conducted by Catherine Chappell and colleagues. And in addition, there has been another recently completed phase 1 study looking at Epclusa in the context of pregnancy, as well as one large multi-center study being conducted currently to evaluate the use of Epclusa in the context of pregnancy initiated at second or third trimester of pregnancy. So although it is not routine, there is a recommendation by the AASLD that DAAs can be prescribed to pregnant individuals on a case-by-case basis. Finally, a really critical aspect of hepatitis C care is making sure that individuals are linked to care after pregnancy delivery. And that's important both for maternal treatment and linkage to care, but also for their infants, because very importantly, infants who are exposed to hepatitis C during pregnancy should be screened to evaluate for vertical transmission. Current recommendations are to screen infants with hepatitis C antibody at 18 months of age, but recommendations are evolving to also recommend earlier testing with HCV RNA at as young as 2 to 6 months of age. Thank you.